Yes, good morning. Thank you so much for watching. Thank you so much for subscribing. Today we have another lecture about characteristics of dental caries. Last time we talked about caries. We said, first of all, these ones are irreversible. They're attacking the mineralized part of the tooth or the calcified part of the tooth, causing demineralization and destruction of the organic part, causing cavities. So today we are going to learn the characteristics of all these parts in terms of how they present. Remember, the tooth, as we said last time, is made up of different parts. So if we have this one as our enamel, this is our enamel. We say the enamel is the outer part of a tooth. This outer part here from here up to here, this is the cementa. The enamel is part of the tooth which covers the crown. And we are saying it is 96% of it mineralized inorganic, meaning it is inorganic material. What do we expect? We expect here a lot of nerves and blood vessels, and therefore there is no pain. What you could see only in the enamel using your physical eyes could be change of color, maybe to brownish. We call it incipient lesion. And you can also see a black spot. That is what we could only see and tell the dental caries is beginning in this part. No pain. We can only have a black spot or the beginning by change of color, what we call incipient lesion. Otherwise, because of having a lot of mineral content in this part, we do not have what? Pain. What of the dentin? The dentin is made up of small components, small tubes, small straws called tuberous. We call them dentinal tuberous. So these small tubes or dentinal tuberous, they are the ones that are responsible for sensitivity. What do we mean? Usually, once we have this is the pulp. In the pulp here, we expect pain because of blood vessels and nerves. But in the dentin, we can also have sometimes what is referred to as pain. But the truth is mild pain or sensitivity. Sometimes you can call it hypersensitivity. Usually, they normally ask this question in the examination, that the pain that disappears on removal of the stimulus, meaning the pain was there, due to the sensitivity. But once it is removed, it disappears. What do we mean here? Once we have tubes remember, in these tubes, we have a fluid. So what happens is that in the case of anything, this is of course the dentin. This is the dentin. Sometimes there is maybe here, there is something hot, or there is cold, or there is pressure. All this, whether pain, cold, or pressure, is going to be is going to move through this fluid and is taken to the palm. In other words, we are not having direct nerves and blood vessels in the what? In the dentin. But whatever takes place in the dentin is being noticed in the pulp, because whichever forces, whichever cold, whichever hot thing is, these temperatures, these forces are transported, or they are able to reach the what? The pulp through this what? This fluid. In case you stop, it means we are not going to have what? Anything. That is why we say, on removal of a stimuli, these ones will not transport anything. And therefore, there is no what? There is no pain. So notice that there is always pain or hypersensitivity, or there is pain on removal of the stimuli. Rather, when there is a stimuli. But on removal of a stimuli, we do not have sensitivity. This one is examinogenic. Usually, once you have dentinal caries, you have a hole which has reached around here. Enamel, and this is the dentin. This is enamel. Once it has finished reaching this enamel, now pain can begin, and it is in this part which has the tuberous. This person, when you take a cold soda or a cold drink, you feel pain. But once you stop, there's no pain. Once air passes, cold air passes, you close the mouth, you feel you are having pain. After some time, you get relieved. If you take cold pineapple, you feel from a fluid pain. Once you stop, when you take something, maybe a fruit, of course, a fruit also causes demineralization because of the strong acid. That's why you shall say, after taking something, something like a fruit, maybe raw mangoes, raw pineapple, you shall feel the tooth, the outside part of a tooth has been, the enamel, because has been demineralized, and you feel you cannot take anything more. But after some time, once it hardens, after some time, it is okay. So we are saying this is dentinal tuberous. We don't have pain, but we can have sensitivity or mild pain, and this pain disappears on removal of a stimuli. This is very important. They may trick you in any way, but once you notice that the pain is in one place, the pain is disappearing and removal of a stimuli, you shall know this is what? Dentinal sensitivity. And I'm saying it is actually supposed not to be pain. It's supposed to be sensitivity, but it can be mild pain. So anything that will disappear on removal of a stimuli, it is what? Dentinal sensitivity or dentinal caries. Do not confuse dentinal caries with the dental caries. Dental caries is the general, but dentinal caries, it is the caries in the dentin. So you can say dentinal sensitivity or dental caries in the dentin or dentinal caries as your diagnosis. Was this given to you in an essay? Thank you so much. We shall continue to talk about it later. So, we talk about the next one, which is pulpitis. Pulpitis, of course, we said after reaching and of course, this is the enamel, this is the dentin, and this is the pulp. So, enamel, we have finished. No pain. It is only a black spot or incipient lesion because 96% of it is inorganic. Here, we only have dentinal sensitivity or mild pain that disappears on removal of a stimuli. Now we are in the pulp. We expect pain in the pulp because pain is brought about by the nervous system, and we have a nervous system, these nerves that are going to enter the tooth through the apical foramen. So here we have the inflammation of the pulp. What causes this? Number one, we are having traumatic exposure. Traumatic exposure. For example, anyway, sometimes if this tooth is traumatized and bacteria enters to the pulp here by any way, we can have what? We can have what? Pulpitis. That is what? Traumatic exposure. Even if a tooth is not sick, but if there's any trauma and bacteria can be able to access the tooth, we can have what? Pain. In form of what? Pulpitis, because the pulp will be inflamed. We also have dental caries. Dental caries, if you have a hole from the enamel going to the dentin and the pulp, because we said this is irreversible. It is not reversed. This is what? Irreversible. So we have cracked tooth syndrome. Cracked tooth syndrome sometimes is difficult to diagnose because usually people, especially on parties, they just get opener, and without opener they want to open the soda, And once that thing is done, you may not see a crack in your tooth. So what happens is that you are going to see a crack will be formed like this. When you do an examination, you may not do this one well. We shall make a video about cracked tooth syndrome, but it is just a crack. May be difficult to diagnose, but you need to know how to diagnose cracked tooth syndrome. And this one can lead to entrance of bacteria, because we said the oral cavity is made up of a lot of bacteria, which is responsible for dental caries. In case saliva or any way, saliva or any bacteria can access this pulp through this crack, we can also have what? Pulpitis. Then lastly, we have rotary instrument. Once we are doing conservation or cementing of teeth, we dentists are supposed to be very careful not to injure the tooth, to conserve instead. So sometimes if we are conserving a tooth, if you are conserving such a tooth, we are supposed to not to touch this part. But in the case you are removing the caries and the rotary instrument, because you are using something to cut called a handpiece, I suppose a handpiece where there is a bar quickly enters this part here. This is the pulp, that red part. This can lead to pulpitis. So it can be one. Sometimes they may not be, but as you're putting cement, you need to protect the pulp, because the pulp is soft, by putting a certain cement which is like an insulator. You know, an insulator. We normally use that cement, maybe temporary cement or what called zinc oxide. It is a cement which is supposed to act as an insulator when you're going to use certain types of cement that are metallic. For example, amalgam. So you're supposed to first insulate, but sometimes people don't do that. So when you put a metallic cement direct on top of the pulp, you shall cause what? Pulpitis, because it will do what? The metallic filling or the metallic cement will kind of what? Cause this type of what? Pulpitis. Which we may talk about it later as galvanic shock. But for now, we are giving it as one of my 4 causes of pulpitis. We need to classify this pulpitis, by the way. How do you classify this pulpitis? We have what we call acute pulpitis. You may have different classifications of pulpitis. Some we shall fear them talking of irreversible and reversible. But the general and simplified way how to classify pulpitis is in terms of acute pulpitis and chronic pulpitis. And acute pulpitis is in terms of the following characteristics. What is acute pulpitis? Acute pulpitis, we are having hypersensitivity. When you take something hot or cold, you shall or you apply a lot of pressure, you shall feel a lot of what? A lot of pain. this pain does not respond to painkillers. You may take paracetamol, you may take tramadol, you may take all sorts of painkillers, but it doesn't respond to what? To painkillers. The pain is spontaneous. Nothing brings it. Whether you have taken something or not, it's just what? Spontaneous. It just comes. The pain can make you awake. You're sleeping at night, it awakes you and make you awake. The pain is not in one area. The pain can live where it may be in the maxilla or mandible and can radiate to the temporal region or to other parts. Or you can have it here and you feel this side. You have it in the mandible, you feel the what? The maxilla. But it can radiate to that temporal region. You feel somewhere, someone telling you, I don't know the exact tooth pain in me, but I feel there is what? There is I have toothache. So this is the pain which radiates to the what? To the temporal region. And we are saying the pain is not localized. What do we mean by localized? Localized means someone does not know the exact tooth. He feels there has a tooth paining, but does not know the tooth which is what? Which is paining. And this one, and the patient does not do what? Recognize the tooth which is paining. I hope you shall be able to know that the pain is intense. The pain does not respond to painkillers. The pain radiates to the temporal region. The pain is spontaneous. The pain, even when you take painkillers, it is not able to do what? To stop. Some of it stops for just a minute and comes again. So this is what? Acute pulpitis. Usually in the examination, they will give you one or two signs there, and they shall tell you, patient X presented with pain in this area. He was not able to identify the tooth. Or you can find he was identifying the tooth, but it was giving him sleepless night, making him what? Awake. Or it was radiating the temporal region. Or any of this, just know you're talking about what? Acute pulpitis. Yes, then we go to chronic pulpitis. This one, usually, many people will get acute pulpitis and will not go. They will use herbs, they will use all sorts of things, and the pulpitis goes into the chronic stage. Once pulpitis goes into the chronic stage, there is the pulp is necrotic. We do not have blood vessels there. They are there, but rotten. So we have the tooth is necrotic. We may have pain or not, but the pain here is usually dull. It may or may not respond to painkillers. The pain is localized. Someone is able to tell you that I have pain. The last tooth is the one paining. The second tooth, the one paining. Or you can even touch and say, this is the tooth giving me hard time. So the pain is dull. It may respond to painkillers or not, and it is localized, unlike in acute pulpitis. I'll briefly talk about the management. Management is in terms of pulpitis, whether acute or chronic, it is exodontia. Exodontia is tooth extraction. The term exodontia means tooth extraction. We shall later define tooth extraction as a painless removal of a tooth or a root of a tooth. When a tooth is paining, when a tooth has been broken, if from inside, we are removing it painlessly. If you remove it with the pain, that is torture. It is not extraction. But you are removing it painlessly. So that is what? Exodontia. We have what we call root canal therapy. This is the modern way of treating teeth. Root canal therapy, especially teeth which can, when you feel it shouldn't be removed. For example, if you have as you have been saying, this is the enamel, this is the dentine, and this is the pulp. So in root canal therapy, the tooth remains in place, but obviously maybe it has a cavity. So in root canal therapy, we remove the carious part using a rotary instrument. We cut this tooth to make sure we enter the pulp. We cut this part, we clean there. When you are doing this root canal treatment, you must protect the tooth. You call it a rubber dam, so that the bacteria from here shouldn't enter, shouldn't be exposed to other teeth. This one, as you do this part, you expose whatever decayed part should be removed. As you do this, as a dentist or as a clinician, you must be knowing the morphology or the anatomy of the tooth. Of course, where the blood vessels are, we are calling them canals. Each tooth has its specific what? Canals. So you enter the canal. This is now the dentine, but you can enter up to where there is around here. We call these canals. Canals. So we have the part of what we call the radicular pulp and also the pulp up above here. So you remove this pulp, this red part here, and also all this you remove it, and also using something which is called like a file. A file is you insert it here into the canal, and the moment it has these hooks, the moment it reaches here, it hooks all this pulp. You also insert another one. The moment it reaches here, it hooks this pulp. Of course, you shall also pour some chemicals, maybe hypochlorite. It will kill all these blood vessels here. At the end of it all, you clean it once, twice, thrice. At the end of it all, you shall end up having this part painless, and you cement it. You cement it. So there was blood vessels, but you clean there using this file and the liquid. After that, you seal this part well and with what? With the cement. And the tooth remains inside the tooth. Usually at the end of it all, we can put what? A crown. Crown is an artificial helmet, I can say. A crown, an artificial helmet of a tooth. But in simple terms, root canal therapy, we leave the tooth in place. Of course, under local anesthesia, you open the tooth using this file, go into the canal, hook the pulp or the blood vessel, it is soft, remove it, pour hypochlorite, clean there very well. After it has dried and there is no pain, maybe on the second appointment or third appointment, seal the tooth and you do what? Put a crown. It is a modern way of removing what? Of treating pulpitis without exodontia. As we said, we are going to look at exodontia. It has effects which we shouldn't benefit from as educated people. This is root canal treatment. We have other treatments. That are listed there. We have a treatment I've put called pulpotomy and pulpectomy. For the part of your exam, I don't think you may need to go in detailed explanation of pulpotomy, but pulpectomy is the root canal treatment of primary teeth. So once we do root canal treatment of primary teeth, it can either be in terms of pulpotomy or pulpectomy. So the moment you talk about treatment of pulpitis in primary dentition, we can talk about it in terms of pulpotomy and pulpectomy. Maybe we can give it as simple as that. We shall have a different topic to go into details how you can do what? Do pulpectomy and how you can do pulpotomy. But in other words, pulpotomy and pulpectomy, these are root canal treatments or they are endodontic treatments of primary teeth, as simple as that. Then lastly, we are talking about antibiotics and painkillers. The moment you either do exodontia or you do root canal treatment, you need to give antibiotics. This one is a very examinogenic topic about dentinal caries, about enamel caries, about pulpitis. If you feel this topic is really important for you, kindly subscribe, share, and like. In case of any comments, please put them in the box. In our messages, we shall read and respond. Thank you so much for watching.